later from his girlfriend, because once I heard that he had taken too much Tylenol, I went to, because he had a live-in girlfriend, I went to her and I asked her, did the ER doctor say anything about Tylenol? And she said, oh yeah, that's the first thing he said, he took too much Tylenol. So then she showed me the bottle of Tylenol that he had taken, like almost a whole bottle that week. Do you remember? Do you know anything?
What was hurting him so much? Headaches?
Yeah, he had a headache initially, right? That was
that's what he.
and body aches.
That's what he told me.
Which also could have been his girlfriend showed me that he was taking a new cholesterol medication, also Tricor. He was on Lipitor, but then he was on Tricor. She wasn't sure if he was taking both of them.
Changed because
I don't. Nobody knows.
Okay.
Nobody knows, but
He was on
Lipitor for a while.
for many over 20
I knew about
years.
So maybe
Lipitor.
lost its
I didn't never heard the
effectiveness or-
Tricor.
I guess. And he also took.
Lita showed it to me. That's why I
well,
kept
you were-
asking
he
you to
took
go over
the
there and get
Lipitor,
it.
And he took
Another
that
one.
Nice pants.
Yeah.
It was nice pants.
Yeah, but she showed me he had a brand new bottle of Tricor. And she wasn't sure whether he was taking both or if he switched to the new one or what. But now, with you being a dentist, how often do you hear people complain about their statin medications? The bad side effects.
Sometimes some people have absolutely no problems at all. It's one of the reasons usually what your physician will do is every so many months, and you probably went through that as well, they'll take a blood test.
Yeah.
And they see how your liver's doing,
Yeah.
see how your kidneys are doing. The combination of, a lot of people have cholesterol, also have high blood pressure. It's normal, they kind of go hand in hand.
Right.
Not always, but very often.
They say the liver causes heart problems.
So you really want to check on both. So if you start seeing that a particular medication is affecting your liver or your kidneys or any other organ, then sometimes they'll change the medication.
Yeah.
Oddly enough, some medications affect some people and don't affect other people
Right.
at all.
Yeah.
You know?
But I think that has
But
probably
that's a lot
been...
of Tylenol to take.
Yeah.
Anyway.
Oh, yeah.
And-
And see, what I heard happens with that is once they get the liver damage from the Tylenol, then they start taking more Tylenol, to try and get rid of those symptoms, which just makes everything
It's just
a
worse.
lot worse. Yeah.
Why was he getting the headaches? That's what bugs me. Was it because he worked in a glass factory? And
I don't know. It could have been from his statin medications, and also...
It could have been. Does he take high blood pressure too? High blood pressure?
I think he
that
was
I
just
knew of.
on statins.
It was just
at the
cholesterol.
time.
Okay.
Yeah.
So if he did have high blood pressure but it was untreated, that can give you headaches. No, then maybe it was a statin. Maybe it was just something else. Some people get migraine. There's just so many. There really are. Can be so many
Sinus headaches
reasons.
too, who knows?
Can be sinus headaches.
Right.
Absolutely.
Sure. I
And
get
then
that.
once he got the liver damage, then that also causes headaches. The
Right.
liver damage. This is just like different symptoms of the liver damage. And you know what the liver does, right?
Yes.
I mean, as
Everything.
far as everything. Yeah,
Everything.
basically
It's a
everything.
filter.
Yeah, it
It
helps you
is.
digest
Biggest
food.
filter we
Helps
got.
your lungs work,
It's
helps your heartbeat.
pretty much in charge of blood clotting. Which that's a big problem with liver damage. People bleeding. So that this tells the symptoms, which Mikey had a lot of them. He had the pain in the upper right side. I don't know about the swelling because I didn't get to see him. Loss of appetite.
I would think his belly looked huge to me. I saw him almost like at least once a week before that happened.
Yeah.
And he did look.
Is he bloated?
His belly did look
Yeah.
big.
And he was nauseated.
I'm a bad film person.
Yeah,
I'm
that's
sorry.
okay. I don't know about the vomiting. I heard he was sick to his stomach.
I heard he had diarrhea.
Then he had very bad
Did he?
diarrhea, and he was sweating excessively.
And he's
too.
dehydrating at the
So he
same
was
time.
sick.
Yeah.
Yeah,
Sick.
yeah.
very
Which
sick.
those are all symptoms of the liver damage.
Was he seeing a physician at this time?
I don't know. I mean, he went to the ER because he was feeling so bad, and I think didn't he have diarrhea?
Yeah.
On the way to
he had
the
an
ER,
accident on
and
the
it
way
was-
there.
I mean, it was so bad that he had an accident. He's 63 years old, so he had a
Was he speaking to his physician? I mean, somebody had to prescribe the.
Yeah, I don't know. I didn't get to
cholesterol.
talk to him.
Okay.
Initially, people were allowed to call the hospital, and then they narrowed it down to just my one sister was the only one allowed to talk to him.
Which is not here.
Yeah.
Yeah, that's okay, because she's, never mind.
Never mind.
Huh?
Never mind.
Yeah. So this just talks about toxic liver disease, damage to your liver, which that's what he had. It's also called hepatotoxicity or toxic hepatitis. It can cause serious symptoms or liver damage if you don't get help. It's medications, herbal supplements, chemicals, solvents, and alcohol are all possible causes of hepatotoxicity. And in his case, the ER doctor told him it was because he took too much Tylenol. So, and then this just says there's over 1,000 drugs that cause, it's called a drug-induced liver injury, so, or Tylenol poisoning. So, and there's an antidote for it, which I don't believe they gave to him. So this is about acute liver failure, and this just tells you the most common cause of acute liver failure in the United States is Tylenol.
Can you obtain those records from the hospital?
I'm gonna try and get them. Yeah,
Probably
yeah.
have to get an attorney for that, though.
Yeah.
Court order.
And this just tells you about how we're so exposed to toxins these days. Like I've read that like half of the population has at least fatty liver disease, and they don't even know it. You don't know until you're older, probably like my brother's age, and you start having problems due to it. But we're just exposed to too many toxins, so many
And
toxins,
just to
like
throw
in our
in, that's why it's good
foods.
to get a blood work every year, a year and a half.
Yeah,
'Cause
but
it'll
that doesn't
show.
always show.
Doesn't always show, but
no,
it'll show a lot.
No. Yeah, so it starts
Guarantee
out.
you this would have shown on a blood work.
Oh, my brother's oh yeah, it did.
Wouldn't-
It did. They
I
said
would
his liver
assume that
enzymes
he
were
had to go
elevated.
see a regular doctor
Yeah,
just to get his
those are just the
cholesterol.
stages of liver
So
disease.
who we should find
So
out
there's
who his
there's
regular
acute
doctor
liver
is
failure, which is the rapid
and go through
development
that route.
of
It's probably on the
hepatocellular
medication bottle.
dysfunction.
Usually is.
But what my brother had,
rare
it's
test,
called
actually.
acute on chronic liver failure because he already had a liver problem. So then he had a liver injury on top of that. And then this is just because he was taking the Tricor and the Lipitor, so this can increase liver toxicity. I don't know what was going on with that. Like I said, I was shown that he had bottles of both. So then you're not supposed to drink either when you have a liver problem or when you're taking statin drugs. This just tells you about the toxicity. Here, you hold that. From the acetaminophen, which is the active ingredient in Tylenol. And then this is the antidote is N-acetylcysteine, which it has, it's extremely reliable, as far as the treatment goes. So instead of giving him it's called NAC. Instead of giving him the NAC, they gave him Lasix, which we do not understand because, he went there because he was, nauseated, vomiting, had diarrhea, excessive sweating, and they gave him a potent diuretic, which that's not going to help him at all.
They take whatever was left out of
Yeah.
him is what it does.
Yeah. So these are just, I don't have his records, so these are just my sister that
I know.
was able
I
to
didn't bring
speak
one. I didn't
to the
know.
nurses and the
We didn't know
doctors.
if we would be allowed.
She's actually a nurse, so she kind of knows what she's talking about. So this is all in relation to his liver enzymes being elevated, which means that liver damage. And that's just an explanation of that liver. So then I want to get to COVID, the link between COVID and your liver. And it says, according to the CDC, some patients hospitalized for COVID-19 have had increased levels of liver enzymes. Not that it's from COVID, it's just they had another liver problem. So then it talks about the enzymes. So it says this means a person's liver is at least temporarily damaged during their illness, during their COVID or their cold or flu, whatever it is. And then it says that people with pre-existing liver disease are at a higher risk of death than people without pre-existing liver disease. And elevated liver enzymes actually occur in, this says up to 58% of patients with COVID-19. So what happened with my brother is instead of treating him for the liver damage, they treated him for COVID. I mean, he was admitted for liver damage because his liver enzymes were elevated. And right after he got admitted, they started treating him for COVID instead, giving him steroids, antivirals. I heard they gave him a cough suppressant, possibly. I don't think he had a cough at all. They gave him the Lasix, which is very, very suspicious, if you ask me. These are just complications of the liver failure. Like we were saying, liver problems can cause heart conditions. Actually, I mean, the liver is the organ that keeps the entire body healthy,
Sure. Yeah.
and detoxifies it at the same time.
Big filter.
Yeah. So he was admitted January 3rd. So for the first 4 days, they kept talking about his liver enzymes being elevated. And on January 7th, my brother said that his enzymes are finally starting to go down. That very same day, they put him on remdesivir, along with a lot of other drugs, which I think is what caused the acute on chronic liver failure. So on the 14th, the nurses told my brother that the medications they were giving him were working, but he would have to stay there for 4 more weeks, which none of us could understand. Why does he have to stay there for 4 more weeks? If they're treating him for COVID, if that's all he had was COVID, I think it's right here. The median recovery time is 10 days when they're given remdesivir. So we didn't know why they told him that he'd be there for 4 more weeks. I'll save these for
Maybe
later.
so they could kill him.
Yeah. Well, actually, yeah, I'll go over this right now. This just shows that the mortality rate for COVID for my brother's age is less than 1%. And then this talks about the days from first symptom to death. But the median hospital stay is 10 days for COVID. And if people die from COVID, it's usually within 14 days because it's actually respiratory related. So there's that. And then this talks about the acute on chronic liver failure. It's the abbreviation. So the mortality rate for that, it starts at 22%. It depends on what stage. There's like 4 stages. So it depends on what stage, starting at 22%, then 32%, then 73%. So it's an average of 33% within 4 weeks. So here's the definition of acute on chronic liver failure. It's an acute hepatic insult manifesting as jaundice, which is the yellow discoloration. Coagulopathy is when they bleed easily because the liver's in charge of blood clotting. So that's complicated within 4 weeks. And then also by ascites, which is the swelling.
Bloating.
Yeah, and or encephalopathy, which is the toxins go to the brain and then they get confused and eventually they go into a coma and then they actually get brain damage from it and then everything shuts down from there. And then that's when they go into the multi-organ failure. And there's also spontaneous bacterial pericarditis. You know what that is, the infection of the fluid from the ascites.
Right.
Yeah, so that's another problem, along with, the sepsis. Just the liver causes so many other problems, pancreatitis. Almost everything in your body is caused from a bad liver in actuality. So on the 17th, my brother started having pain. I heard he had pain prior to that, and he thought it was indigestion, like in his upper right side, where they say the liver, where the liver pain. Liver pain you can also get in your right shoulder, your right back, like your whole right side, right neck, yeah.
I didn't know that.
Mhm.
Crazy.
And that's where he was all bruised and
Well,
looked like hematomas and all that.
no,
to his
not yet.
Not yet?
Not there yet.
We're
I'm
getting
not to
there.
that
We're
point yet.
getting there.
Wait. Yeah. So he had pain, and then they said he had a hematoma on his chest. And you know what a hematoma is? Just a small area of mostly clotted blood. Nothing to be concerned with, right? So they stopped. They were saying that was from blood thinners. So they stopped the blood thinners and they did a CAT scan to check out his chest. At the same time, they said his O2 saturation was good, which means that his lungs were working good, right? Because it's bringing the oxygen
Exactly.
in, so there's nothing wrong with his lungs.
It's a good thing.
Yeah, yeah. And a lot of these highlighted areas is where it says the nurses don't want him to talk on the phone, because I don't think they wanted him to be able to communicate to us what was really happening.
Yeah, I talked to him.
So, yeah, but I think they made it difficult.
It was hard to hear him.
Yeah.
And understand.
Yeah. So he
Oxygen.
supposedly he has this
Yeah.
hematoma on his chest,
It was hard
and
to hear him when you're standing next
but the
to him.
doctor, who's Dr. Jessica Lee, starts saying that his lungs are so inflamed that they may have to intubate him, and that his lab levels aren't as good as they were due to him working so hard to breathe, which that doesn't make any sense. But at the same time, she said his hematomas look better, but his liver enzymes were elevated again due to illness, and without disclosing what his illness was. And then she said he felt better. That's just the definition of the hematoma.
Right.
So instead of a localized area of mostly clotted blood, Barbie went to the hospital and she took
Yeah.
these pictures of my brother hemorrhaging. That's a severe hemorrhage.
That's on his right side, right?
Yeah.
Mm-hmm.
And, I mean, that's right where his
Typically.
the coloring didn't come out on this very good,
Right,
but
right,
that's
right.
it's a dark
I
red.
know.
Barbie, show it to him on your phone. She's the one that.
No, I got
But
it.
yeah,
Yeah, that
it's
looks
dark
almost
red
black.
right
I can
here.
imagine, I
So
can
it was
imagine,
it
It
was
was
still
awful.
actively bleeding. This is on the 20th. She said that on the 18th that his hematoma was healing. So this is on the 20th. He's got a severe hemorrhage. The dark red color showed that he was still bleeding. Down here it was black, so that shows that it was like 4 to 5 days old. So it wasn't a hematoma, it was a severe hemorrhage, which the hospital
Big
lied
difference.
about.
Big
Yes.
difference from the one on his chest.
Yeah, she said
Yeah.
it started on his chest and drained down, but you can see it's goes all the way
Not.
up his arm. And I'm seeing this in a lot of so-called COVID patients. The bleeding, bruising, which is liver related.
Yeah, that
So-
one photograph of a lady you have.
Yeah, I have a
Mhm.
lot of.
Okay.
I've spoken to so many people where almost the same exact things happen. So that's the same day, and the
Close
monitor in the
enlarged.
background, I enlarged, and you can see this is his pulse, 104, and his breathing rate is 36. And for some reason, they had his blood pressure and his temperature disconnected, but I'm sure they were both really low. Because if you look at the hemorrhage and you look at that, and you look at this hemorrhage chart, like the pulse, it's right between a 2 and a 3 with the pulse, and then with the breathing rate, it was 36. So he's like around a class 3 hemorrhage, and then he was also anxious, he had anxiety, so they gave him medication for that, which they shouldn't have done either. They also gave him a blood transfusion, but never admitted that he was hemorrhaging or anything. So if you put that together, he was actually going into hypovolemic shock, which, due to the hemorrhage, could have also been due to the Lasix they were giving him too. So he was going into hypovolemic shock, but they were telling us that it was because his lungs were inflamed. And they kept referring to this hemorrhage as a hematoma or a bruise instead. Let's see. So the hemorrhage probably started around the 14th or the 15th, because of that black area. So this is the 27th where the Dr. G said he will check Mikey's bruise and advise us. So he's still checking this supposed bruise or hematoma on the 27th. What is that, like 14 days later? So obviously it's not just a bruise. So now we're here to the 30th. When did he go on the ventilator?
I don't have the dates.
Yeah, I wish I knew because I talked to him and he said they were going to put him on a ventilator the next day.
Yeah, I think it was right after that.
I think it was the day after this.
Yeah, it was real close right after that because,
Yeah.
like I said, he was going into hypovolemic shock. But they said no, his lungs are inflamed. They said his hematomas are healing, but his lungs are inflamed. But they said his O2 saturation was good, which means his lungs were fine.
To make up your mind.
So on the 30th, Lita was Mikey's girlfriend. So they let her call, and they put the phone up to his ear, and they said his eyes were wide open. So supposedly everything was fine. The doctor said, I kept on telling my sister, I said, ask him about his liver, ask him. And she asked, and the doctor says he doesn't have any liver damage, which is a bunch of baloney. But they said that his gallbladder was becoming distended, which is from the liver damage. So then the day after that, his liver enzymes went up again. He was on 20% oxygen, which is that's just natural air, meaning he was not receiving any supplemental oxygen. That's on the second. And that just explains the natural air. Oh, but at the same time, it said he had diarrhea, and they were going to check for C. diff. So the diarrhea must have been pretty severe, because C. diff is pretty, it says it's an urgent medical, it needs urgent medical attention. So they were checking for that. Now, like I have a bunch of doctor friends, and I was communicating with them all throughout this, and they said that when he had that diarrhea, that he was starting to die at that point, because his body just lets loose of everything. So the next day, my sister kept calling the doctor. The doctor wouldn't take her calls, wouldn't call her back that whole day. The day after that, they said they took out my brother's catheter and IVs. And we're like, why are they doing that? Are they taking him off the ventilator? But they didn't take him off the ventilator. Also, he went from 20% oxygen to 90% oxygen, which actually means that he lost his brain function right then. And then they let Barbie do a FaceTime call with him that day, and that's what he looked like. And I also sent this to my doctor friends, and they looked at it and they said, that's it.
He's gone.
Yeah. So, and they wouldn't allow FaceTime calls until this point, apparently, so we couldn't show any symptoms or actually communicate to us what was really happening. But he was on the ventilator still. So this talks about brain death and how they can keep you on a ventilator, and it'll make the heart continue to beat without any nerve impulses from the brain. And it keeps their skin warm, it keeps the heart beating, but the person is dead. So that's what I believe they did. It's just her, Barbie's FaceTime call. So the day after that, what did they do? They gave him more Tylenol. Now, you're never supposed, he shouldn't have taken Tylenol to begin with.
At all.
But
Yeah.
why would the hospital give him more?
And
That
then they
makes
gave
no
him more,
sense.
which I believe was just to finish him off. So
quiet
this
him
is the
down.
5th. No, they were just
Yeah, it's horrible to
just
say,
make
but you're
sure.
right.
Yeah, it was.
But you're
And then this is
absolutely
just
right.
me talking about, failure to administer the NAC, which was the antidote, because of late presentation is considered medically and legally inappropriate, which I don't believe they never mentioned it. I don't believe they ever did give it to him. So then the day after that, they said, he took a turn for the worse, and that his lungs were so damaged that his other organs were going to start shutting down, which I believe he was already dead. So the 5th they gave him more. The 4th, I believe, he died somewhere between the 2nd and the 4th. And then the 5th they gave him more Tylenol. The 6th they said, that he took a turn for the worse, and then he wasn't going to make it. So the 8th, you went there on the 7th, right? You went to see him, I think, the day before I did.
I
That they
did
allowed
go there
us.
the first day that we heard. I went there and I just went and I did.
Yeah.
I did.
Yeah, I went
And-
right after you
Swollen
called
like
me and
that.
told me I could go up and see him. I'm thinking he was okay.
Yeah.
Go up
I
and see
went
him.
on the 8th, and
My boss dropped me off there that day because I was freaking out at work, and he's like, "Can I take you somewhere?" I'm like, "Take me to the hospital."
yeah. So one thing I skipped over is that the hemorrhage, that's that coagulopathy, because when the liver fails, like I said, the liver's in charge of blood clotting. So that's why he was bleeding. And I've also been told by doctors that like they see teenagers that try to commit suicide with the Tylenol, and they say that most of the time they die because of bleeding. They can't stop the bleeding.
Right.
So that's what that really was. But on the 8th when I went, so I think Barbie talked to the same Adam, that unit manager, and he's telling me all this stuff about COVID, you know, how it does this and that to the lungs, and my brother's lungs were turning into concrete, you know, so his lungs weren't working, and then, you know, his other organs would fail. So when somebody's lacking oxygen, do you know what happens to their skin?
Turns color.
Blue, right?
Yeah.
Cyanosis. So this is that day he's telling me that his lungs, you know, are shut, his lungs aren't working anymore. He wasn't blue at all. I mean, he was actually yellow. There was no blue anywhere. His lips, his tongue, his eyes. His fingers were not blue. You know, usually cyanosis, the fingers are all blue.
Right.
You can see how swollen they are. And the coloring didn't come out well in this either, but he's pretty yellow looking. No blue, just yellow. And then another thing my doctor friends told me is there's bleeding here at his cuticles, and that's from the pulse oximeter, and that's also due to the liver failure, because like I said, they bruise and bleed easily. So that was from the pulse oximeter being on those fingers. And they moved it all the way to his pinky, which is the last finger that it's supposed to be on, because you don't get accurate readings on the pinky, but they had it on his pinky. So, and then this is the picture Wayne took. What was it, the 10th or the 11th?
I'd have to really look it up on
Yeah.
the phone to find the exact date.
And you can see
He
how
died
dark
on the
he has
11th.
gotten. I mean, he was in the hospital for a month and a half, and he got darker. You don't get darker, you know, and you're not exposed to any sun. But I did also research like the changes in a body after death. And around 10 days after death, they start turning darker like this, which puts it exactly on my timeline of when I think he actually died. But, you know, in the end, they ended up blaming it on COVID, which I think he was.
And why, after he's
was
passed,
a
why
week.
would they keep him on after he's passed? I don't understand
Just-
that. The prolonged agony, what?
I think just to cover everything up. And, well, I hate to
was a
say
week
this in
home
front
with
of
COVID.
Jace. I'm sorry?
He was a week home with COVID.
Yeah, it
So
was, he was almost over it by the time he got there.
He was a
Yeah.
week home, he
Well, it
died-
wasn't
he died.
COVID that killed him. It was his liver.
Right.
I know.
Well, in
But they were treating
actuality,
him for COVID.
yeah,
And he was
that's
already
the
a week
problem.
over
knowing
COVID.
that it would kill him, because just the fact that he was on statin drugs is a contraindication for all those COVID drugs, because they already know the liver's not working, and those drugs are all hepatotoxic, you know, which will just cause more liver damage. And they lied about it all along, you know, saying it was a hematoma or a bruise when he was actually hemorrhaging. He was actually going into hypovolemic shock. It wasn't his lungs, you know. And then they kept him, you know, artificially breathing. They gave him more Tylenol just to make sure. And like I was going to say, I researched the changes in the body, you know, after death. I don't really want to talk about that in front of Jace, but you know, there's a certain point where you're flaccid, then you're rigid, then you're flaccid, and then you bloat, and then the fluids come out. And like when Barbie went, like his eyes were watering, and I held his hand, and his hand, just fluid was coming out
The
of him.
weirdest thing about his eyes that were watering is the tears were on top of his lids, not on under his eyes.
Right.
They
Yeah, and
were all up here.
his whole body was wet when I
It was
went.
so weird.
And then, like I said, around 10 days is when they start turning dark. So I missed that one picture. This is the last picture taken of him a week before he went to the hospital, and then that was the last picture. So you can see the color change.
Sure.
But I was going to show you, I don't know where the picture of him, the last picture of him, it was at our family Christmas party, and he's got a bottle of beer between his legs. So that could have been what started the headache also. But there it is. This is the last picture taken of him. Bottle of Corona.
Yeah.
So, and then I think it was the next day that he was ill.
He had COVID.
Did they
That's
actually,
what they say, but
did they test him for COVID when he went to the hospital?
I don't know. But
I assume they do.
and see, this
Would
is
think.
this is exactly his illness followed this timeline exactly. You know, the symptoms and everything. You know,
Or you can get a false positive.
I don't
These
believe.
kits that they give you in the
You know, I
pharmacy
work.
That's what he tested with.
says you have it, and
I've
the
worked
next
in
one says you
dentistry
don't.
for over 30 years, and I mean, and even since COVID, nobody in dentistry has died of COVID, and we're exposed to more bacteria and viruses, I think, than anybody else.
Right.
You know, one office I work in is a Medicaid office. I see 4 patients every hour, and I'm covered. I wear a visor, but I'm covered with blood and spit, and
Just breath.
Nobody-
You've got immunities to it, probably.
No, nobody in dentistry has died of COVID. And,
Right.
you know, they talk about volume load. You know, the more you're exposed to it, the sicker you're supposed to get.
Yeah.
And like I said, we're
I think it's
exposed
the
to it
opposite.
more than
Yeah.
anybody. Because in the
Yeah.
hospitals, people wear masks. Not that
Same
masks
thing with the
do
ER
anything.
nurses too.
Sterile and everything.
Yeah, but I mean, people take their masks off, and we're working in their mouths, and all the aerosols
Yeah.
are right in our faces.
Yeah, I never got it, thank God.
Yeah.
So, you know, one thing that strikes me right off the bat is that very often when people pass in the hospital, it may be put down as COVID as the reason, not just in this case, but in many cases, but there's all these contributing factors, and they aren't the ones that are really the main cause according to the hospital. That's not always accurate. You know what I mean? It can
Yeah.
be the other
Well, and the
things.
fact
So
that he was
I think you
admitted.
just, I
admitted
think you
for liver
really
damage.
need, though, some professional help. You know, I think you need I mean, you can talk to your doctor friends a little more and see if they recommend anybody, but that you should talk to an attorney.
I've spoken to some, but as far as what I hear, they're not allowed to do anything if they put COVID on it.
Yeah.
And you know, I've talked to other people that are, you know, have lost
How about
loved
we don't put
ones and-
COVID on it? How
What if
about
we
we
just
put
call-
severe liver damage when he went into the
Well,
hospital?
she means on the charts.
On the
Yeah.
The
charts.
official charts
Yeah.
that come from the hospital, yeah. So, and the first thing you gotta do is get his records. See what's in his records, because there may be something important in there.
Well, I mean, not that I would go by his records because they lied to us the whole time anyway, you know, saying that he had a
But if
hematoma
there are
instead of a
incongruities
hemorrhage.
in the records, it may show. Like if it's not congruous, if it doesn't make sense all the way along, still might show, even if it's not accurate or truthful. So I still think that's worth looking at to see what they've put down, so you know what they're saying.
Yeah.
And the fact that there was
There is no easy
autopsy
answer.
report.
Look, you know, I've said all along that I had a lot of concerns with some of what's gone on with this disease, and it's not to make it, it's not a political thing, but it's another loss of freedom a little bit. You know, it's
Oh,
just
yeah,
that
absolutely.
I would go right now that you should not allow people who have COVID to just be isolated. This is supposedly COVID people that have it. And, you know, families aren't allowed to come in, wives even aren't allowed, or sisters
Yeah,
or
because they
brothers.
do whatever they want
right,
to these
they keep-
patients.
Right, and the patients don't even know sometimes.
Yeah, and
so-
especially with liver damage, you know, they're confused because of the toxins,
Sure.
and they'll go along
whatever
with
they have, 'cause they
whatever.
have a lot of secondary
All
stuff.
they
So
want to do is feel better, and they're thinking
Yeah.
like
Yeah,
they're there to help
exactly.
You're
them.
gonna help me.
Yeah.
Help me,
I'm gonna let you
please.
do what you want.
to, you know, it's funny, a couple ladies that their husbands were friends, and they both died, you know, and they didn't even get to really see them when they passed, you know, which is a horrible thing. So
No, so many people have died, but alone.
yes, alone, which is
It's the
never
worst
should
thing in the
be.
world to be
Never
alone.
should be, yeah. So
Yeah. Well, from my research, you know, I've talked to so many people. My friend down in Florida, because I put this on a website so I could prove everything. She read my website and she said they did the same thing to her mother. Her mother was on statin drugs. She took Tylenol. They also gave her Lasix in the hospital, which there's no reason whatsoever to give, you know, so-called COVID patient Lasix. You know, especially like my brother. I mean, he had diarrhea on the way there, and then they're giving him a diuretic. You know, they should have just given him the antidote and IV fluids is what they were supposed to do.
You need to find out why they were giving him this medication.
I think it was to hide the swelling, the ascites, because that's what they give to patients that,
To
have,
drain 'em.
yeah, exactly. Yeah.
So they drained
And
him.
then, and another friend of
Of
mine,
life.
she's a dental assistant actually. Her husband was in the hospital recently for like 3 or 4 months, and they're young, like in their 40s. And she showed me a picture. I cleaned her kids' teeth, and so she was there, and she showed me a picture of her husband laying in the bed. And she was telling me he's got pancreatitis, and they removed part of his pancreas. But he's laying in the bed, and his stomach's out like this. But his stomach wasn't like that before. And I said, that's his liver. And she says, well, he didn't say anything about his liver. And I said, well, that's his liver. And then his hands were all swollen, and he had rash is liver related. And so she asked the doctor, and the doctor said, no, his liver's fine. But then she asked one of the nurses, and the nurse said his liver's in bad shape. So they kept on treating him for all these other problems. Oh, and then one day she sends me a picture of all these bottles filled with fluid, and it's when they drain the fluid, I forget what it's called, so I forget what it's called. So I said, that's from his liver. And she says, well, they're saying there's nothing wrong with his liver. And then I didn't get to talk to her much after that, but then she came back to the office, and he had been discharged, and she told me that they wrote on his discharge papers that he had cirrhosis of the liver, which is where it's, basically so scarred that it's irreversible at that point. But the whole time they kept denying it. They kind of did the same thing with my mother. I've spoken to so many people, with those liver symptoms, but they're getting treated for COVID instead. And like I said, elevated liver enzymes occur, and it says up to 58% of COVID patients. But if they're treating them for, treating a liver damaged patient for COVID, it's going to kill them. And they know that.
Yep, and we
They
shouldn't
know
let the
that.
pharmaceutical company rule what the doctors do. That's the problem, I think. The pharmaceutical companies are so money hungry
Oh, yeah.
that they dictate what doctors can and cannot do.
Well, wasn't Pfizer going out of business and Fauci got together with somebody and
I
said,
hope
let's
it all
bail them
burns.
out?
I don't watch the news
I heard
anymore.
so
I haven't
many
watched
things.
it in
I hope it all
months.
burns.
So much
Well-
conflicting stories going on. You don't know
I
what to believe.
will keep it in mind,
Mhm.
which is all I can do at this point.
Yeah,
so I'm being
yeah.
honest with you.
Well, most
and be real
importantly,
aware of it. And I was aware of some of it, and I've been questioning and concerned with that a lot. I could send you a lot of stuff I've said.
yeah, I mean,
done
people
about it, but
mostly need to be made aware so it doesn't happen to them.
yeah,
You know,
Afraid to
and
go
like
in the
I
hospital for
said-
knee surgery.
Yeah, I would be too.
You come out with
Yeah.
a toe tag on.
And they need to know, how drugs affect their liver. I mean, drugs, it kills your liver cells.
Yeah.
So does alcohol.
Look
and
what they just
a lot
did
of other
recently
things.
to somebody that was the owner of the custard stand on Delsey Drive.
Uh-huh.
He just
And
died.
He
Did
did.
he?
I didn't,
Yeah.
I didn't know.
What's that place? Serene's?
What happened to him?
Cerrone.
that's-
Cerrone. He went in for knee surgery. You don't die from knee surgery.
No.
Yeah, that's
You think
pretty
I'm going to go in
unusual.
now? No,
No.
I'm going to limp for the rest of my life.
Yeah.
Whatever that is.
I
That's what I
mean,
do.
70 now, I got 10 more years, okay.
You
You
know,
ain't going to kill me.
Yeah, I mean, a lot of people say, oh, they have bad reactions or bad side effects to drugs, but in actuality, it's probably liver damage. And then when you throw more drugs on top of that, then it just causes more
Well,
damage.
if this comes to be truthful, God's honest truth,
Mm-hmm.
then the hypocritical oath that doctors take is totally false.
Yeah.
Thou shalt do no
Yeah.
harm.
Well, I'll
Really?
tell you what, my cousin's
Pharmaceutical
Knowingly,
loophole.
yeah.
urologist, and he's the one that told me. I sent him the picture of my brother hemorrhaging because the hospital was claiming it was from the blood thinners, and my cousin said that's because of the liver damage, and he's the one that explained to me, when they're damaged,
Right.
you don't clot. But in actuality, he should have told me also that at that point they're supposed to refer him to a liver specialist.
Absolutely.
And the hospitals aren't doing that. They're just covering it up, if you ask me. And, they treat the symptoms and they make the problem worse and then they blame it on COVID. And on my brother, it's interesting that after this happened, he was in there for like a month and a half. Our women's club, they had a financial advisor come in. He was an attorney and he was talking about life insurance and all that. And he was saying that he says, you have to remember, if your loved one's in the hospital, after probably a month and a half, you're around $1 million, in medical bills. And he says, and most plans max out at $1 million. And that's the time they had my brother in there. Like I said, they gave him that 4-week timeline, but that was actually based on the acute on chronic liver failure, because that was the timeline for that. It takes about 4 weeks, for the liver to fail. But then also for the insurance to max out too.
Milk the insurance company.
Yeah. And it was the same thing. My friend down in Florida, her mom was told 4 weeks also, when they were giving her the treatment. And we're like, why would they say 4 weeks?
And now you know the answer
It's
to my
not-
first question. Why did they keep him there so long?
Yeah. And then I think they make deals with the families and say, oh, we'll write off the rest. And then I hear that, if they put COVID on the death certificate, that the funeral expenses are covered.
It's true.
Yeah.
They put COVID on my mom.
Hospital
My mom
gets
in
a
the hospital
larger
gets extra
reimbursement,
too.
I want you to tell him about your mom. When they told you she was dying, and then
Yeah.
they stopped giving her drugs. You tell him.
She was in the hospital. She went in for, what was it? Heart failure. She was in congestive heart failure. And they stopped all the drugs because they told us there was nothing they could do. They gave her last rites. I signed papers. They weren't going to, try and save her, or they weren't going to put her on life support, anything like that. As soon as they stopped the drugs, everything started to change. She was blue when she went in the hospital. I lost
Yeah.
my phone.
Oh.
I lost my phone.
You know what? I have those
I
pictures.
sent it to you.
Yeah.
She was blue when she went into the
She
hospital.
was all bruised up.
She was blue. She was
like
swollen.
a liver patient.
She got better?
And swollen.
As soon as they stopped the drugs. Like I said, we read her last rites. It was like 4 o'clock in the morning. She woke up. She's like, call your brother. I'm going. Me and my sister were with her. We call her. We call my brother. He comes up. She's, we're sitting around her for 2 hours, crying, All of a sudden, she pops her eyes open. 6 o'clock. It's 5 or 6 in the morning. Oh, I guess I'm not ready yet. I'm like, are you kidding us? And she came home for 10
Nice
months.
to plan your own death,
But
isn't it?
she was swollen and bruised up too.
And they stopped all the drugs because she was on all kinds of.
Did she make it for a little while?
10 months. She was on all kinds of pain medication for her back. She had spinal stenosis. She had deteriorating disc. She was on all kinds of medications, opiates and stuff like that for the medication. And as soon as they stopped giving them, as soon as they stopped, you got the pictures and text message.
They're on that.
Oh.
Let me see if they're.
It's okay.
I mean,
Yeah, but
literally
she
was
looked the
so
same
swollen
way.
up and blue.
And then my friend in Florida, also her mom, she sent me pictures of her mother, and her entire arm was black and blue. And one thing she told me they did to my brother, they put arm restraints on him, and when the toxins are going to the brain, they start having panic attacks, and they do hand flapping
Right.
and stuff. So they had arm restraints on my brother, and she told me they did the same thing to her mother. And her arms were just covered with bruises, and then she was all swollen also. And then she went into it's called a hepatic coma, but they told her that it was encephalitis. But it was really from her liver. And like I said, they gave her the 4-week timeline. She was still in the coma, so they transferred her to hospice, and then she
I lost
passed in
my phone right after I
hospice.
went.
Those all the same medications. Like I said, the Tylenol, the Lasix. And I've read that, COVID patients receiving, those 2 drugs in the hospital had the worst outcomes. One more. This girl I talked to, I actually saw her on a video on the internet where she was talking. They're in their 40s also, and she's in Michigan. So she was talking about her husband passing from COVID, and she's talking about it. I'm like, that's the same thing that happened to my brother. And then I got a hold of her because they gave an email address. And I asked her, I said, did your husband take Tylenol? And she said he didn't take it at home, but when he got into the hospital, they pumped him full of it. And that one of the doctors there said they were giving him too much Tylenol, and he was like fighting for it. And then she said she's heard the same thing from others, but the Tylenol causes severe liver damage. It's the number
Well, that
one
we know,
cause of
yeah.
acute liver failure, and it doesn't take much, especially if you already have liver problems, if you're drinking alcohol.
What is
We're already
the
fighting something.
what is the medical term for Tylenol? Is it actromycin?
Acetaminophen.
Pseudomediphin.
Yeah, also
Because we used to carry that in our aid
paracetamol or
bags all the
something.
time, and I always wondered why they'd want us to push that.
Yeah,
was
and why do
generic.
they push it for COVID when it's not even an anti-inflammatory? Because the biggest threat of COVID is what, systemic inflammation, and they push Tylenol. Tylenol only helps relieve mild pain and fever. That's all it does. Besides
I don't
causing
know true
liver
stats, but I
damage.
gotta imagine Tylenol is one of the biggest, I don't know, manufacturer, whatever you call that. So they must have
Pseudomediphin.
probably, you know, a few
Like
years
Advil
out
is,
to promote this
ibuprofen.
to hospitals, and then hospitals are, you know, I don't know what the right word is, not required, but strongly suggested to use their products.
Of
And I
course,
think that's
keep
what
the pharmaceutical
happens.
companies in business.
And I know, and I feel like they focus more on the medicine and getting, I call them drugs. I
I
don't
do
care
too.
who gives it to you, it's a drug. And then it
Excuse me.
ends up taking the people from us that don't need to go. Because some people just need time to rest, some people just need fluids. If you just keep pumping them full of drugs,
It's going to keep hurting their
you
liver.
keep hurting them. It would be
Yeah.
like, I don't know, I'm not a good like drunk or anything like that, so it's hard for me to describe it, but I gotta imagine if you're drunk and you just drink more, you're just gonna get more drunk, right?
Yeah.
Till you pass out, and then you don't drink no more.
Right, until the next day you
And
wake
they
up and you
say
feel
that
like
it
ass,
takes
right?
the liver like
Yeah.
months to
Right.
recover from that if you
Why don't
drink too
drink?
much.
Yeah,
Also
exactly.
from Tylenol damage, it takes
So
about
why
a month.
would the doctors who are trying to protect us and take their oath and keep us healthy, why would they do that?
Give us drugs that hurt us.
Why
Money.
would they do
Yeah.
that?
MONEY.
I'll show you.
Hopefully not all.
This
Yeah.
is my oldest brother. He died when he was 4 years old. At first, they were telling my mom that he had the flu. And I remember it was before I was born. He passed in 1957. But I remember her telling me they got real skinny and his belly got big. And I came across this, when I'm researching this stuff on my brother, I came across this picture of this child, you know, they're doing a liver transplant. And I showed this to my mom. I said, Mom, is that what he looked like? And she said, yeah, that's what he looked like. And she said that they had contacted St. Jude's,
Right.
and St. Jude's refused to take him. This adorable little 4-year-old boy refused to take him based on the
That's Jimmy.
doctor that diagnosed him. I'm like,
We
that
never
doesn't even make
believed him
sense.
either.
Why did he not think he didn't have cancer? And so my mom said that the hospital here, I think it was Newcomb back then, they cut him open and they said that it was too late and there was nothing they could do about it, and they sewed him back up. But like in this picture, you can see like his stomach's getting big, like it does in the acute liver failure, that's ascites. Yeah, and it wasn't like, I said, Mom, was, if they said he had a tumor in his belly, you would think it'd just be in one spot, but it was like she said his whole stomach got big. And yeah, so he passed away. But do you know when Tylenol first came out?
I don't know the year. Was it the 70s?
No, that's what I thought too. 1955, 2 years before my oldest brother
Wow.
died. My mom doesn't remember anything about any medications or anything that he might have
Yeah, I know it was around that
taken. Yeah, it came out as a children's elixir in 1955, and my oldest brother died in 1957. But
So, listen, you gave me a lot to think about, and I certainly will, and we'll do a memo on it to everybody in the office.
yeah, I
and
mean, people need to
doesn't
be
mean we
made
can do something
aware
immediately, but maybe
about the
we
liver
can do an
damage,
awareness.
and the
If nothing else, tell people
Tylenol.
to stay off drugs. Period.
Yep.
All drugs.
Well,
all
out of the hospital.
drugs.
Yeah,
all drugs.
I mean,
And
they
out of the
don't even
hospital.
think of Tylenol. That's the really bad part.
They
Is
don't think of it as a drug.
yeah, I mean, everybody
like taking an
takes
aspirin or-
Tylenol. They take too much of it, and they think nothing of it.
Yep.
But it's really dangerous.
There's a lot of things that are killing Americans.
Yeah.
Yep.
Yeah.
One of the many.
Yeah.
Well, guys,
Close the
thank
southern
you.
border,
Thanks for
Biden.
listening to